Okay, so in this video, we'll be taking a look at another important topic of pediatrics, that is infective endocarditis. So, what are the important points that you need to know as a final year MBBS student regarding infective endocarditis? So, just like rheumatic fever had the criteria called as Jones criteria, the clinical criteria for infective endocarditis is the Duke's criteria. Now, in order to diagnose infective endocarditis as having a definitive diagnosis, we should meet at least two major or one major and three minor criteria or five minor criteria. So two major or one major and two and three minor or five minor criteria. Then the disease will be labeled as definite, having a definitive diagnosis or definite diagnosis. And in order to label it as having possible diagnosis of infective endocarditis, you should meet at least one major and one minor criteria or three minor criteria. So what are the major and minor criteria? Let's take a look at that. So the major criteria involve having positive blood culture for typical organisms of infective endocarditis, and there should be a evidence of endocardial involvement on echocardiography. So positive blood culture and endocardial involvement, these two are the major criteria. Now what are the minor criteria? These are the predisposing valvular or cardiac abnormality. For example, a child is suffering from rheumatic heart disease or any congenital heart disease like VSD, ASD, etc. And or if the child or the patient is a IV drug abuser, if he is having a pyrexia or fever of more than or equal to 38 degrees Celsius, if there is a embolic or vascular phenomena, or if there is a suggestive blood cultures which are not typical for infective endocarditis but the cultures are positive, so that will be minor criteria. And if there are certain echocardiographic findings like there is a valvular lesion or there is some endocardial abnormality on echocardiography, so there are six minor criteria involving predisposing valvular or cardiac abnormality, IV drug abuse, pyrexia, embolic or vascular phenomena, suggestive blood cultures and echocardiographic findings. Now what are the immunologic and vascular phenomena that we have talked about in the minor criteria? These include splinter hemorrhages, Osler's nodes, Janeway lesions, retinal infarcts in the form of Roth spots, microscopic hematuria and heart murmurs, because we will find a change in the character of heart murmur with time. So a changing heart murmur basically. So these six are the immunologic or vascular phenomena seen in infective endocarditis. Okay, so in addition to these criteria or these phenomena, we can also find necrotic skin lesions, finger clubbing and pallor or anemia in children suffering with infective endocarditis. Now what are the investigations that you're going to be ordering in a child of infective endocarditis? Number one will be the blood cultures, and you need to take at least 3 to 6 sets of blood cultures, and echocardiography which will show the valvular heart disease, very important here, and ECG which will show AV block, infarction due to emboli, chest x-ray which can show cardiomegaly and heart failure, blood examination will show raised ESR, CRP, and CBC will show leukocytosis, urinary exam will show proteinuria, microscopic hematuria, and blood serology will show antibodies against different organisms. So these are the important investigations that you're going to be ordering: blood cultures, echocardiography, chest x-ray, ECG, blood examination, urine examination, and serology. Now once diagnosed, how will you treat a case of infective endocarditis? So it involves medical and surgical treatment. Medical treatment options include identifying and removing the source of infection which is causing infective endocarditis, because in infective endocarditis there is a direct infection of the heart wall and the endocardium. So for example, if there is a tooth with apical abscess which is the source of infection, then you have to extract that tooth, and in addition to that you also have to give empirical therapy for 2 weeks. And the choice of antibiotics involve for subacute endocarditis, because that is mostly caused by Staph aureus. The choice for these organisms include amoxicillin or ceftriaxone with or without gentamicin. So amoxicillin or ceftriaxone with or without gentamicin in case of subacute endocarditis. In case of acute endocarditis which is caused due to strep viridans, the choice of antibiotic will be vancomycin and gentamicin. For penicillin resistant stains, we will give vancomycin plus gentamicin, and for patients with having prosthetic heart valve, we can give vancomycin plus gentamicin plus rifampicin. Rifampicin will be added in case of prosthetic heart valves. And if it is streptococcal, after a streptococcal sore throat or after a streptococcal infection, then we will give benzathine penicillin. So these are the choice of antibiotics for different cases, for different scenarios. So the surgical therapy will include cardiac surgery with debridement of the infective material on the heart walls, and also valve replacement if required, or if the case is severe. Okay, so cardiac surgery can also be done to debride the infective material from the heart walls and valve replacement. Now, the DD for infective endocarditis is rheumatic heart disease, and the complications of infective endocarditis includes congestive cardiac failure, myocardial abscess, pulmonary emboli, and aneurysm formation. So these are the important points regarding infective endocarditis, and we are done with this. I hope it was helpful for you guys.